Hi, I'm Caitlin Kennedy and I'm an audiologist here at Cook Children's. We are here in our sound booth, which is where we test your child's hearing, and I'm going to go over with you today how to read an audiogram, which is how we'll chart your child's hearing. Alright, so this is an audiogram. It's where we'll chart your child's hearing after their hearing test. It can be kind of confusing to read because it's upside down from a normal graph. So when you look at this, on the far left side is low bass pitches, and all the way over on the right side is high squeaky pitches, like a mouse or a flute, something like that. At the top is the softest sounds that anyone can hear. All the way down to the bottom is the loudest sound that we measure. So hearing at the very bottom of the graph is equivalent to an airplane taking off nearby. When you get your child's hearing test, it will look similar to this, with X's and O's and brackets all over it. The X's are for your child's left ear, and the circles are for your child's right ear. The brackets also go with right and left ears, but it's a different way that we test hearing. What we're looking for with the X's and O's is for all of them to be up near the top of the graph. That's what tells us someone has normal hearing. After your child's hearing test, you will hear their hearing described with some kind of marker, like normal, mild, moderate, severe, or profound. That's how we let your child's physician know how their hearing was in our sound booth today. So if you look at this graph, you can kind of see where all those markers fall on the graph. If your child had normal hearing, the X's and O's on the graph will all be near the top. But as you go further down, you get to those different levels like mild, moderate, severe. Your child could have a combination of those levels too, like mild to severe hearing loss in both ears. If we pull up the X's and O's again, you can see with this hearing test, this child had normal hearing because everything is at the top of the graph. If your child does have a hearing loss on their test, there are 3 different kinds of hearing loss they may have. It could be conductive, it could be sensory neural, or it could be a mixed hearing loss. So let's go over what all of those are. A sensory neural hearing loss happens when there's damage to the inner part of the ear or the hearing nerve. With a sensory neural hearing loss on the audiogram, you're going to see the X's and O's outside of that normal range. You're also going to see those brackets close to the X's and O's. That tells us that your child is hearing the same no matter what kind of headphones we use to test their hearing. On this graph, you can see that the X's and O's are further down. So if this was your child's hearing test, we would say that they had a mild to moderate sensory neural hearing loss in both ears. All right, so the next kind of hearing loss we're going to talk about is a conductive hearing loss. A conductive hearing loss typically will happen if there's something blocking sound from getting through your child's ear. It could be something like earwax that needs to be removed, or something like an ear infection. If there's a conductive hearing loss, we're always going to recommend that you follow up with your pediatrician to see what could be causing that hearing loss. On the audiogram with a conductive hearing loss, what you're going to see is the X's and O's further down the graph, but those brackets are higher up on the graph. What's happening with those brackets is we probably put this headband on your child's head, and it lets us test just how their hearing nerve is working. So if they heard normally with their hearing nerve, but with headphones on, we had to make sounds a little louder, we know that they have a conductive hearing loss. The final type of hearing loss we're going to discuss is a mixed hearing loss. Like the name implies, a mixed hearing loss is a combination of a conductive hearing loss and a sensory neural hearing loss. So this can happen if your child has a permanent kind of hearing loss, plus has something blocking sound from getting through their ear. So on the audiogram, with that mixed hearing loss, you're going to see the X's and O's for their right and left ear further down the graph. And the brackets will also be further down the graph, but there will be a space between the brackets and the X's and O's, letting us know that there is some permanent hearing loss, but your child also has something blocking the sound from getting through that needs to be checked by a physician. Thank you all for watching this video. If you have any more questions about your child's hearing or how to read an audiogram, please go to cookchildrens.org.